Hi, everyone. Thanks for joining us. We will be getting started shortly, just waiting for people to trickle in. So we'll be waiting until at least 10 o'clock. Good morning, everyone, and welcome to our webinar, Streamlining E-Billing for Auto and Workers' Comp Injury Claims. We're delighted to have you join us today. My name is Lauren Hickey, and I'm your host for today's webinar. Today's session is brought to you in partnership with the Insurance Council of New Jersey, Carisk Partners, and the Hanover Insurance Group. E-billing is transforming the way we manage auto and workers' compensation claims, especially in light of the recent New Jersey state mandate. Today, we'll explore key updates, share insights from different perspectives, and outline services that can help simplify and enhance the e-billing process. Let me quickly walk you through our agenda for today. We'll start with a brief welcome and logistics overview. Next, we'll dive into introductions and meet our panel of experts. We'll then discuss the New Jersey state mandate for e-billing and its implications for the industry. Following that, we'll hear the payer's perspective and gain insights into how payers are adapting to the e-billing requirements. Then we'll cover clearinghouse services and discuss tools and resources available to simplify the billing process. Finally, we'll wrap up with a Q&A session to address your questions. Before we begin, just a few logistics. Today's webinar is being recorded, and you'll receive a link to the recording after the session has concluded. Questions throughout the webinar are able to be submitted through the chat feature. A Q&A session will follow the presentation. Presentation slides and additional resources will be emailed to all attendees at the conclusion of the webinar. And please complete this post-webinar survey to share your feedback and suggest topics for future sessions. Now, let's introduce our speakers. Today, we're joined by a panel of experts who bring a wealth of experience in e-billing, auto and workers' compensation claims, and the insurance industry. Our first speaker is Christine O'Brien, President of the Insurance Council of New Jersey. As President of the IC&J, Christine oversees the general operations of the organization and serves as primary spokesperson for New Jersey's property casualty industry. Christine has over 30 years of experience in the field of public affairs, specializing in executing legislative initiatives, public relations campaigns, and grassroots mobilization efforts. She was a partner with the lobbying firm Gluckshaw with a focus on the New Jersey legislative and executive branches, specifically in the areas of property casualty and health insurance, utilities and energy alternatives, healthcare, and social services. Prior to Gluckshaw, Christine was the director of Trenton operations for the MWW Strategic Communications, a global government affairs and communications firm. In addition to working in the private sector, Christine served as the Director of Scheduling and Advance for Governor Jim Florio's re-election campaign and as legislative chair for the state Million Mom March Brady campaign to prevent gun violence. As a volunteer, Christine recently served 20 years as a member and chairwoman of the Mercer County Board of Social Services. She's a Leadership New Jersey Fellow and holds a BS in Speech Communications from Syracuse University. Christine resides in Hopewell, New Jersey with her husband and 2 daughters. Our second speaker is Greg Estelle, Program Manager with the Hanover Insurance Group based in Worcester, Massachusetts. He has oversight of medical programs that support the adjusting teams handling workers' compensation and PIP claims. Prior to joining the Hanover Insurance Group in 2007, he spent 10 years managing PPO networks at the Hartford. Greg makes his home in Haddam, Connecticut, where he and his wife have raised 4 boys. Our third and final speaker is Sally Baglioni, Vice President of Sales for the Clearinghouse Division at Carisk Partners. Over the past 6 years at Carisk Partners, Sally has overseen the sales operations, which includes responsibility for submitter and payer sales, as well as CIC's software vendor partnerships. Sally is the liaison for clients with Carisk's internal stakeholders. Sally brings to Carisk over 20+ years of experience in product and software sales, customer service, and new business development. Prior to joining the company, Sally worked for several of the nation's top publishing organizations as a C-level sales leader. Sally resides in Wall, New Jersey with her husband, Rob, and their 2 children, Robert and Jenna. Sally holds a master's degree in business administration from Monmouth University from West Long Branch, New Jersey. Thank you all for joining us today. And without further ado, let's dive into our first section. Christine, I'll hand it over to you to get us started with the New Jersey state mandate.
Good morning, everybody. Thank you, Lauren. As Lauren said, I am Christine O'Brien, and I am the president of the Insurance Council of New Jersey. The ICNJ is a not-for-profit trade association, and our membership consists of all of the admitted carriers writing property casualty insurance in New Jersey. We are primarily the advocacy arm for the industry. That means we work with legislators, the regulators, and the governor's office. We collaborate with our industry partners. That can include the agents, attorneys, and vendors like third-party claims management companies. And in this way, we are able to work together to promote a more affordable and accessible insurance market. So one of the things we do with our members is we collaborate on legislative initiatives. And back in 2015, one of the ICNJ associate members, which then was IHICFA and now is Carisk, had legislation introduced to mandate the electronic billing for workers' compensation claims. The goal of the bill was to establish a system that created efficiency and expediency in the claims process with an eye on paying providers in a timelier fashion. A companion bill was then to establish a similar mechanism for PIP auto claims was then subsequently introduced. Definitions for the bills separately needed to be negotiated among the different interested parties. You'll see on this slide, one of the sticking points that we had early in the process was how to define an electronic bill, because that did have to be defined differently for the payers and payors, pays in comp versus auto PIP, which of course have different, very different fee schedules and other mechanisms in place. The ICNJ originally opposed the legislation, and along with providers and the joint insurance funds, we opposed the original bill in its introduction, which actually made for very strange bedfellows. It's not often that the insurance companies get to work side by side with the different provider communities. So in some ways it was a weird welcome, but in other ways we knew we had a lot of work cut out for us to craft this bill. There were several issues that needed to be addressed for the insurers to support the bill. Of course, we wanted the best outcome for our associate member who got the legislation introduced. So we worked on the bill with the sponsor, who was Senator Oroho at the time, IHICFA, and primarily the Medical Society of New Jersey, to address all the concerns that you see listed here. There were questions, as you can see from the bullets, about what would the internal capabilities be for the insurance companies even from a strict IT perspective. What did it mean to mandate participation, which really was a sticking point? Neither the insurers or the providers wanted to be mandated to have to enter into an electronic billing arrangement, particularly if they didn't have the capabilities. We wanted to talk about, would there be a penalty as to whether or not you engaged in e-billing or not, or should the market drive that and make that more of a volunteer program with encouragements for participation. We needed to clarify on the PIP auto side, the determination of what is a compensable bill. What did it mean for those who already, insurance companies who had contracts with PPOs and third-party payers? And then what would happen to the smaller provider practices that were low volume providers in terms of their billing? So all of these issues we basically hammered out. That resulted in the legislature ultimately passing the bill in 2016 for the comp bill, 2018 for the auto bill, and then the governor signed it into law. So part of, I think, what we want to talk about this morning is how is electronic billing within comp and PIP auto working today from an insurance company standpoint? And to answer and elaborate on that question is my colleague from Hanover Insurance, Greg Estelle. Thank you.
Thank you, Christine, and thanks for joining us this morning. So I'd like to take just a few minutes to highlight some of the ways in which e-billing benefits both the payer and the provider. So e-billing brings efficiency and cost savings to the bill submission process. It is much more efficient to enter bill data, which is captured and sent electronically to the payer or to their bill review party. The data is ingested and fed quickly to the payer, which eliminates days of mail time. Submitting that data electronically saves paper and reduces the need to maintain bulky hard copy storage. Additionally, Carisk has software edits that prompt for invalid data entry and allow for correction at the time of submission. That means corrections can happen before the payer or bill review company begins that submission. E-billing also improves accuracy and consistency. We'll go to the next slide, please. As I mentioned, there are validation edits at the point of bill submission to ensure accurate data is submitted. When the payer gets all the bill information with the original submission, we avoid expensive and time-consuming efforts to collect the information needed to process a bill. And of course, that reduces cycle time. All of your bill information and submission status is stored in one repository. That makes it easier to find and manage the information. And standardized and accurate data enhances our ability to analyze the data and manage our claims. And from a customer and provider experience perspective, I'll head to the next slide. Providers and claimants are obviously more satisfied when payments are processed accurately and timely, and they avoid the runaround. It's significantly easier to check the status of a submission in Carisk than it is to contact the bill review company or even the payer regarding a paper bill that was sent in but hasn't yet been processed. Additionally, e-billing promotes compliance with timely filing, timely payment requirements. And it's easy to track progress and demonstrate timely submission within the Carisk platform. And the solution that Carisk offers is an easy way to stay compliant with the expectations around e-billing. So let me turn it over to Sally, who will talk you through the Carisk solution and details on how to succeed with e-billing.
Thank you, Greg. Good morning again, and thank you all for your participation today. My name is Sally Baglioni, and I am the Vice President of Sales here at Carisk Partners within our Ancillary Services division. Carisk Intelligent Clearinghouse is much more than a liaison between submitters and receivers. At Carisk, we provide next-generation medical clearinghouse services for healthcare providers and payers nationwide. We facilitate the electronic submission of workers' compensation and no-fault auto bills, along with all the required documentation. We provide outreach services for our receiver clients with acquisition success, all while providing the highest level of support and service to our partners, large and small. This morning, I'm going to begin with some information about the role of the clearinghouse in the electronic billing process. As an intermediary connecting submitters and receivers, your clearinghouse plays an important role in ensuring a smooth workflow for e-billing. Your clearinghouse needs to customize the integration to your needs and provide the necessary process options suited to your day-to-day billing steps. For receivers, your clearinghouse needs to provide data files in the required format for seamless ingestion into your adjudication system. And finally, if a payer provides a response file or a remittance, it needs to be uploaded and attached to the original claim and stored so that the user can see the full life cycle of the bill and have access to it as needed. So you'll see on this slide some integration from submitter to receiver. Let's step back and review some important points about clearinghouse technology. 95% of all health insurance bills are transmitted electronically. The industry overall had moved to electronic billing many years ago. However, for no fault and workers' compensation, fewer than 30% of all bills are transmitted electronically. This is primarily due to the documentation that is required to justify the medical services rendered, and this requirement is for all automobile or work-related injury claims. Because the same systems are used for all bills generated within the practice, electronic billing for no fault and workers' compensation is actually much easier than you might think. Implementation of electronic processing of these bills allows your team to focus on increasing your accounts receivable and will result in a more efficient billing process for both healthcare providers and claims administrators alike. In order to achieve the most efficient workflow possible, your clearinghouse needs to specialize in no-fault auto and workers' compensation. We've seen where group health clearinghouses have tried to submit these claims and often fall short because of the documentation requirement, resulting in non-payment or delayed payment of your claim. Your clearinghouse also has to have a flexible end-to-end process and provide you with a trusted and secure solution for your patient bills. We at Carisk were early adopters of the e-billing process, and as Christine spoke, we were involved in the mandate that became a law in the state of New Jersey. And we've been doing e-billing for these two categories for over 20 years. We are committed to customizing each and every connection to meet our clients' billing platform specification and our receiving partners' adjudication algorithms. So we try to be flexible from both sides. Your clearinghouse needs to make your transition to e-billing seamless and provide your team with all the support they might need. This is a rendering of our homepage, and you can see it's very user-friendly, and the format is designed to make the platform easy to use, intuitive for the user, and we provide training as part of our implementation process at no additional cost to the user. We have a live man help and support team to assist with tracking of claims and processing issues that you might have in your day-to-day billing process. Our end-to-end solution has the capability to attach your medical record documentation as part of the electronic data interface file that is submitted for the claim. If your billing system has that capability, it's a simple connection. If not, our system will allow you to attach the medical record as a secondary step. Our system validates all of the claim data prior to processing it, as Greg mentioned earlier, so that when it does go to the receiver, it is a clean and correct claim. If for some reason there is missing or incorrect information, the system will alert you when a bill is incomplete or missing documentation so that you have the chance to correct it before it is processed through to the insurance company. All of this, and we make it easy. There are just 3 simple steps for both providers and payers to enroll and establish connectivity. Our implementation specialists coordinate meetings with your team and oversee the process, which could include being the liaison with your billing software vendor, testing your electronic data interface files, the submission of your initial production files, and hand-holding through the beginning process of your e-billing steps. We provide training and support so that we can ensure the process is painless to you. CIC is connected to every no-fault and workers' compensation payer in the nation, as well as every state entity that has an electronic pathway. We also offer print to mail services for those carriers who do not have electronic billing. And as you can see from the sampling of our partners, we are one of the largest submitters to many of the top payers in the nation. A complete payer list can be found on our website, or we can email it to you at the completion of this webinar. As a bonus to our payer partners, we provide acquisition programs for paper submitters. We have a dedicated sales team who will convert your current paper submitters to electronic with the same white glove service that we offer to all of our clients. For these programs, our marketing team can support a provider acquisition plan with a number of assets used by or in conjunction with the payer partner. Those assets could include educational materials with features and benefits for submitters, emails and social media campaigns, customized demos of the clearinghouse functionality to really explain to the prospective submitter how easy the process can be, as well as webinars like this one we're doing today. Our program includes a comprehensive outreach plan by a dedicated and professional sales team, the marketing tools necessary, and reporting to our payer partners on our e-billing conversion success. This also includes a yearly refresh of the paper submitter list for continued progress and increased penetration for electronic billing. And finally, our partnership includes advanced business intelligence for early identification and intervention of high-risk injury cases and long-term case analysis. All of these offerings and our commitment to support and service the client that you will not find anywhere else in the industry. That's why we are Carisk Intelligent Clearinghouse. We do much more than just process your bills. That concludes my portion of the presentation. Please let us know if you have any questions or if you're interested in seeing a customized demo that can be scheduled at your convenience. With that, I'll turn the presentation back to Lauren for Q&A.
Thank you, Christine, Greg, and Sally, and thank you to everyone who has submitted questions in the chat feature. We'll now take a few minutes to address as many questions as we can. The first question that came through says, is it really easy to bill electronically?
I think I can take that question. We try to, at Carisk Intelligent Clearinghouse, make it as easy as possible. As I mentioned, we have a team of implementation specialists who work through the training and implementation of your e-billing process. Because we have been doing this for over 20 years, we have many available mechanisms for billing electronically, from manually entering a bill on our clearinghouse platform to scanning a PDF of your claim and having it transcribed to an electronic bill, to connections with over hundreds of billing software platforms across the country that have already done the integration steps. So if you're using a billing vendor that we are already connected to, it merely takes a call to your billing vendor to say you're going to connect to Carisk, and they will take the necessary steps to set up that secure connection.
Thank you, Sally. Another question that came through in the chat says, how much do they charge for their billing services for PIP? We are a small office with small volume of PIP claims.
At Carisk, our pricing model is based on volume. So the cost to submit a bill is 50 cents. So you only pay for the bills that are submitted and accepted by the insurance company through the clearinghouse platform. So if you only submit one bill, it's only 50 cents. If you have a larger volume, you pay based on the volume. And we do have larger programs for hospital systems and large billing companies.
Thanks, Sally. This question was for Christine. It says, what if I continue to bill on paper?
Sorry about that, take myself off of mute. That's a good question, because that was part of the discussions about a penalty. The law does not have an explicit penalty for non-compliance, but for those practices that are exempt from the requirement of e-billing, which would be if you submit 25 bills or less per month, if you don't do that electronically, you may be subject to non-payment of those paper claims. It will vary perhaps from insurer to insurer. And really, my experience with the member companies is that as electronic billing adoption increases, and as Sally mentioned, it has been standard for health for quite some time, there may be fewer resources available to process manual claims, resulting in longer turnaround time to you, the practitioner. So it's a choice that you have.
Thanks, Christine. Another question that came through says, does Carisk offer this for all lines of business, such as general liability, et cetera? How do you ensure the validity of the TIN and payment address when there are many third-party billing entities associated with the rendering provider?
Well, I'll take the first part and then the second. From a standpoint of the type of claims that Carisk processes, we specifically stay in the PIP and workers' compensation lane. We do not submit or process any group health claims. It is a niche because of the required documentation that needs to be sent with the claim to justify the services rendered. So for 20 years, we've only done work comp and no fault. All of our clients have a group health clearinghouse that they use to process bills on that side of the house, and then utilize us for work comp and no fault. From a directional perspective for where the bill goes electronically, once an electronic pathway is established with a carrier, there is only one. So from a paper submission standpoint, if you're in the Northeast region, you may have been submitting your claims to a regional office in the Northeast, versus if you're in California, you may be submitting your claims, to someone on the West Coast. Once an established electronic pathway has been set up, there is just one pathway to that carrier. So there's no question of where the bill has to go because the electronic pathway is created in such a way that there is just one entity. If there is a bill review company in the process, that's set up as part of how the bill travels through the clearinghouse. So we do submit many bills to bill review companies for the carriers that they represent. So from a submitter standpoint, your steps should not change whether the bill goes to a bill review company or the insurance company direct. Each of those processes are established uniquely for the insurance company based on how they want their bills to be reviewed and adjudicated. From a validation standpoint of the TINs, I think that was part of this question, we through the setup of your account, do the validation of all your credentials on the front end to ensure that the TINs, your MPI, your service location, all of the information that would be validated on your claim is correct in the system before you start submitting live bills. So that is the framework that we utilize to validate the bill and ensure that it has all the necessary information for processing. So that's part of our setup. So we ensure that the account is set up correctly with all the appropriate credentials prior to submitting live bills for you.
Thanks, Sally. Another question that came through says, if I bill electronically, how much faster will my claims get paid?
I can take that. Good question. So while payment cycles can vary from one carrier to another, I think you'll find that for clean claims processed without the manual intervention, without the mail delays, payment can be made in as little as 14 days. So it's a pretty quick turn.
Thanks, Greg. Another question that came through says, as we use Eclipse software in our office and are considering their cloud version, has CIC had any issues with that cloud version of Eclipse?
I can take that question. We have not. We spent a long time working directly with Eclipse. They're a great vendor partner of ours when they converted to the cloud, and our implementation team is on a first name basis with the customer support team at Eclipse. So, in the initial phase of transitioning most all of their customers to the cloud, we were probably, on the phone with them day to day. But once we got through that initial conversion, things have been running very smoothly. As I said, we're work very closely with them. So when there is a problem, we know them on a first name basis. They call us directly, and it's usually resolved, in the same phone call. But we have not seen any, specific problems with the cloud versus their previous platform.
Thank you, Sally. I think that covered all the questions that came through in the chat. But if we didn't get to your question, or if you have additional questions after today's session, please feel free to reach out. We're always happy to provide more information or schedule a one-on-one discussion. For further assistance or to learn more about how our solutions can help streamline e-billing for auto and workers' compensation claims, please don't hesitate to contact us. You can reach us by email at the emails below, or visit our website at cariskpartners.com. We're here to support you and help answer any questions you may have. Just a quick note on a few post-webinar logistics. A PDF of the presentation will be emailed to all attendees later today. A link to the full recording of this webinar will be available via email and posted on the Carisk Partners YouTube. We will also be sending any relevant materials and resources related to today's topic to all attendees. And to receive updates on upcoming webinars or resources, you can email me, laurenhickey.com lauren.hickey@cariskpartners.com. And please complete the post-webinar survey to provide feedback and share your ideas for future topics. Thank you all again for joining us and for your participation today. We hope you found the session informative and valuable. And a special thanks to our speakers from Carisk Partners, the Insurance Council of New Jersey, and the Hanover Insurance Group for sharing their expertise. We look forward to connecting with you again soon, and I hope everyone has a great day.
Thank you, Lauren.
Thanks all.
Thank you, everybody.
Thank you.
Have a great day.